On behalf of our Good afternoon and welcome to our discussion with Arizona Senator Mark Kelly. My name is Dana Marie Kennedy, State Director with AARP Arizona, and today I'll be hosting the session. Thank you for joining our conversation today. Thank you and welcome Senator Mark Kelly. AARP Arizona has 900,000 members in Arizona. On behalf of our volunteers and staff, we appreciate you taking the time from your busy schedule to speak with AARP members. We're appreciative that you're willing to take a few minutes to update our AARP Arizona members on updates in the United States Senate and your priorities. For those joining us today, today's guest is United States Senator for Arizona, Mark Kelly. Thank you for joining us today, Senator Kelly. Remember, we want to hear from you, our viewers. We have received many questions already, and we'll try to answer as many questions as possible. For those on the Zoom video call, we have questions for our guests. Please ask your questions in the question and answer section. It's my honor to introduce United States Senator for Arizona, Mark Kelly. Senator Kelly, it's our pleasure to have you live here today. Will you please give us a quick update on what's happening in the United States Senate and your priorities?
Well, thank you, Dana, and the AARP Arizona crew for having me here today. And thank you, everybody, for joining us. Great to be here. As always, it's been a busy time for me so far in the United States Senate. Busy 7 to, I think, coming up on 8 months now, because I got into office in December. And since I was sworn in, our major focus has been, as you might expect, is fighting this COVID pandemic. It's been like nothing any of us have ever seen before. It's been a challenge. And we're not out of the woods yet. But I want you to know that I know this has been a very difficult year and a half for so many of you. Many seniors who didn't have access to PPE, didn't have access to the technology they needed and groceries and prescription drugs. And that was often during the height of the pandemic. And many seniors lost their caregivers and struggled with loneliness and faced terrifying outbreaks in their communities. And then once the vaccines finally showed up, rather quickly, but when the vaccines arrived, many folks in rural and underserved areas had trouble getting vaccinated, having access to these vaccines. So in December, we passed an emergency relief bill. And then again this year, beginning of this year, we passed the American Rescue Plan Act, which provided desperately needed resources to folks around our state. And I was able to get $1.4 billion in funding for the Older Americans Act into this bill that funds vaccine outreach and nutrition delivery, preventative services, and also caregiver support and some other things. And I'm really proud of that success. It's incredibly important. But we still have a lot of work to do. I'm hearing from folks around our state that the cost of their prescription drugs keeps going up. In some cases spiking, in some cases doubling or tripling. And folks have told me they have to decide whether to buy groceries or pay their rent or buy their medication. And that's just not right. And it does not have to be that way. The big drug companies shouldn't be able to make huge profits off the backs of Arizonans, especially Arizona seniors. So please know that lowering the cost of prescription drugs remains one of my top priorities. And I'm hopeful that headed into this fall, we'll be able to take some real concrete steps to fixing this and making this a reality. And I'll continue to advocate for this with my colleagues and also from my position on the Senate Special Committee on Aging. So I'm going to stop there, and I know we're going to get to some questions, but thank you again for having me. I really appreciate the invitation.
Thank you so much, Senator Kelly. It's great to hear from you and all your priorities. We know that many of them are what AARP has been advocating for. So I'm going to go ahead and kick it off with a couple of questions that are top of mind for AARP. First of all, thank you for your support for the Credit for Caring Act. And why do you see this legislation as vital for Arizona caregivers?
Well, it's incredibly important legislation. And I want to just say thank you back to all of you at AARP. I know that AARP has been a leader in developing this legislation. In Arizona, we have about 850,000, 900,000 or so family caregivers who provide billions of dollars worth of unpaid care every year. And we know that during the pandemic, folks were providing, in some cases, 8 additional hours of care each week, in other cases, even more than that. And this is hard work. And I know that. I know that from my experience supporting my wife, former Congresswoman Gabby Giffords after her injury, and also supporting, my parents after they each were, diagnosed with cancer. And whether it's caring for a child or an aging parent or investing in technology to help families, it's not easy and it's not cheap. The Credit for Caring Act would provide a tax credit of up to $5,000 for working caregivers. And this would help offset the costs that families have to pay out of pocket to care for a loved one. It also is a way to place value, significant value on this work that is done by countless family members. And I am proud to support this legislation. And again, thank you to AARP.
Thank you. One of the top searches we have on the AARP site is how to get paid as a family caregiver. So a lot of family caregivers have to leave work in order to care for their loved one. It's not possible always for them to work as well as care, so they actually leave their job. So this Credit for Caring Act is really important. So thank you so much for your support on that. And one of AARP's biggest goals has been to lower the cost of prescription drugs. And we know this is a priority of yours as well. What are some of the solutions you see working?
Yeah, Dana, as you just stated, reducing the cost of prescription drugs, big priority of mine. I know it's a big priority for folks at AARP as well. And I'm hopeful we're going to make progress on this in the coming months. I'm a co-sponsor of Senator Amy Klobuchar's legislation to allow the federal government to negotiate drug prices under Medicare Part D. This would allow HHS, so Health and Human Services, to directly negotiate with drug companies for price discounts for Medicare prescription drugs, drugs that are bought under Medicare, eliminating what's called the non-interference clause that bans Medicare from negotiating for better prices. By allowing Medicare to use Medicare's bargaining power, this proposal will lower the rising costs of prescription drugs for Arizona seniors and help ensure that they can afford the medication they need. I also know that we can help seniors afford their drugs by capping the Part D out-of-pocket costs for seniors enrolled in Medicare. And we should do that. There's bipartisan support for efforts to lower prescription drug costs. And I'm going to continue working on this because this is just a system that has been set up that is fundamentally unfair to seniors. And I look forward to making some progress here.
I've been working on this issue for over 20 years. Do you think we can actually get this done?
I think we can. I am optimistic. I mean, we have been talking about this recently, and it only makes sense to do this. I mean, the system that we have today results in seniors paying more for prescription drugs than other individuals that get their drugs from other government programs. And to me, it's just it's an issue of fairness.
Great, thank you so much. Well, we also have another staff person from AARP that's going to be joining us. We have Brendan Blake, and Brendan Blake is going to be asking you some questions that we receive from our audience as well as volunteers. So Brendan Blake is our brand new Associate State Director for Advocacy for AARP Arizona. And it's great to welcome you, Brendan. So thank you so much for asking the Senator the next questions from our volunteers and guests.
Thanks, Dana, and thank you, Senator, for joining us. It's a pleasure to be with you again. Hope that you're well. We're going to jump right into it. We've gotten a ton of questions, and fortunately, you have been able to answer a few of them already, specifically on the Medicare part. So if you don't mind, I'm going to continue on that track. We had a question that there have been rumblings for Medicare recipients to include vision, dental, and hearing. What can you tell us about that?
Yeah, that's incredibly important as well. I mean, me personally, Now, I don't know a single person on Medicare who does not have a need for vision, dental, or hearing care, sometimes all three. And also think that they're getting those services at a good price. They're often not. So, but here's the thing. I also know that folks on Medicare who aren't getting those services at all, it's because they can't afford it, and Medicare doesn't cover it. And I've seen statistics that says, something like 75% of individuals on Medicare who need hearing aids don't have them. That's a big deal. I mean, it affects their well-being and in so many other ways. On top of that, 70% or so of individuals on Medicare have difficulty eating because they haven't gone to a dentist. And more than, I think, around 40% of individuals or so on Medicare struggle to see because they can't get access and can't afford an eye exam and glasses. So if folks aren't getting preventive care, if they can't get preventive care, it adds costs on down the road, costs more later. So we'd be really smart as a nation to go ahead and provide these benefits. In the long run, it could save us money and makes the quality of life for seniors so much better. So we need to work out the details on this, and I certainly need to review them. But I'm really hoping that we can get this done so that Arizona seniors can get all of the health care they need through Medicare.
Thank you, Senator. We're going to go ahead and change gears a little bit. We have a question here on transportation, that they've heard that you've been involved in the transportation space, and they'd like to hear about some of the work that you've done in that area.
Yeah, one of the committees that I serve on, so I serve on the Armed Services Committee and the Energy and Natural Resources Committee, but I also serve on the Senate Environment and Public Works Committee, and that means transportation. And we were able to pass a bipartisan transportation infrastructure bill earlier this year. I think every member of the committee voted for it. That's kind of rare. And our chairman, Senator Carper, was very proud of that. And that piece of legislation, so that makes historic investments in upgrading our highways, roads, and bridges. And that's not only about transportation and infrastructure, but that is also about creating jobs and connectivity too. And I personally spearheaded the push for dedicated funding for our state's bridge repair, as well as specific funding for tribal infrastructure. If you spent any time on our tribal nations in Arizona, the need for funding for infrastructure, it is very clear. You don't have to spend much time there to realize that. I also know how important it is, for Arizonans in rural and also tribal areas to have safe roads that they can travel on to get to work, to get to school, to get to the store or the doctor. And, we've seen just how important that is over the last couple of weeks. I mean, fortunately, we got a lot of rain, but that resulted in a lot of flooding. And so it's important that we have good roads. I'm also part of this, you may have heard of this bipartisan working group, coming up with a bipartisan infrastructure plan and legislation that will include historic investments in transit. And we are working on that this week still, but we're making progress. And it is important for me that we get seniors and all Arizonans connected and get them affordable options to get where they need to go.
Well, Senator, thank you for that. Transit is one of my personal points of personal privilege. I serve on a board of a nonprofit that does transportation for seniors in the Northwest Valley. So to hear the work that you're doing on that is great. So thank you very much for that. Speaking of infrastructure, we're going to move on to, you've mentioned infrastructure and rural areas. So I can't not go on without asking a question about rural broadband and what has been happening there as well.
Yeah, so this pandemic made it very clear how critical broadband access is for school, for work, for healthcare. At the beginning of COVID-19, I was on the phone with one of the former presidents of the Navajo Nation, and he was telling me how because young people who came back from NAU, ASU, U of A didn't have broadband, at home, they're all crowded in the McDonald's in Tuba City at the beginning of the pandemic. That's not a good public health situation. We need to get rural broadband across the entire state, across the country. It's incredibly important. And part of the American Rescue Plan, we made an investment in this, in expanding access to broadband. And just last month, Senator Sinema and I announced nearly an additional $1 billion in federal grants from that legislation to be used to expand broadband in tribal areas. We also announced the opening of a new program at the FCC that provides an emergency broadband benefit for certain households. And I've introduced bipartisan legislation that's going to cut red tape, cutting red tape to make it easier and faster for broadband to be installed on federal lands. And finally, this is a priority as we work on infrastructure legislation, broadband is, to invest in bringing high-speed internet to more Arizonans.
Great, thank you. And we have a follow-up question on a previously answered question. What are the government programs that currently can negotiate for prescription drugs?
Yeah, so the VA is allowed to do that, right? Let me back up though. And the reason why Medicare can't, it's written into the law that the head of Health and Human Services, the secretary, can't negotiate or interfere with drug prices. This is called this non-interference clause. I'm a co-sponsor of legislation that's going to get rid of this, to eliminate it. But which, just as an example of if you get your medication from the Veterans Administration, if you're a veteran, you're buying the same medication and you're paying less for the same drug than a senior who is getting that same medication through Medicare. Because the VA buys drugs directly from manufacturers and can negotiate prices. Medicare can't. And the result of this is that the VA pays about as half as Medicare Part D does for some brand name and generic drugs. So, think about that for a second. They pay half. Imagine the impact that's going to have on Arizona seniors if folks on Medicare are paying the same as veterans who get their drugs through the VA. This is going to make a big difference. And as a veteran myself, it's just kind of crazy to me that to see these two separate programs that are, basically the same, but one American pays more than another. That's not right.
Yeah, I agree with you, Senator, and certainly has been something, as Dana mentioned, that we are laser focused on and have been for a few years now. So thank you for your efforts on that. And Dana, I'll go ahead and pass it back to you.
Great. Thank you so much, Brendan. Those were great questions. And we do have a lot of questions from our audience. Many of them are asking questions that we've actually already asked you. So we are fairly close to the end of our time, and we know that you have a meeting right after this. And this is a question that was submitted by several members. What are your thoughts about Dreamers? Not necessarily a question that AARP usually asks a candidate, but since it was asked by several people and people are asking a lot about border and immigration. So what are your thoughts about Dreamers?
Yeah, so let me first say that the Dreamers are just as American as my own two kids. I have two daughters, 26 and 24 years old. And Dreamers are a big part of our community in Arizona. We've got about 400,000, I think, 400,000 Dreamers in the state of Arizona. We need to fix this. Our immigration system is broken and needs to be fixed. So I've been a supporter of a pathway to citizenship for folks under the DACA program, for years. But, there are other reforms that we need as well. We can't be ripping families apart. Families need to have the ability to stay together and continue to be here, to be part of our community without a fear of deportation. And in our state, in Arizona, and this is true for other states too, this would be a big boost to our economy and to our workforce. And this is, by the way, is broadly supported by so many folks in Arizona. From Arizona business groups to community advocates, it's incredibly popular to fix this problem. So I'm going to continue to work with folks on both sides of the aisle, Republicans and Democrats, and the administration in the White House to pass reforms that reflect our values, that keep communities safe, and that supports Arizona, the Arizona economy, and finally fixing this issue with Dreamers and getting them a pathway to citizenship is vital.
Thank you so much. And is there anything that is happening on the Senate Finance Committee on Aging that we didn't ask you that you may want to share with our members?
Well, so yeah, I serve on the on the aging committee, and we are constantly addressing issues that seniors care about. Whether it's issues about caregiving, prescription drug prices, access to nutrition. During the COVID-19, there wasn't many highlights for that for anybody. For me, being able to participate in a Meals on Wheels program and helping Arizona seniors was a big deal. We talk about those issues on the committee as well. A lot of issues, regarding, healthcare, but healthcare among seniors.
Thank you so much. We know how important that committee is to Arizonans, as well as aging people who are aging and family caregivers. And would you like to make any closing remarks before we end? We know you have a hard stop time, and we really appreciate you giving us this much time.
Thank you, Dana. Yeah, this is a busy day, as they all are here in the United States Senate, and I think it might be a late night tonight. So thank you, Dana. Thank you, Brendan. I always enjoy coming on and speaking with your members. We've got a lot on our plate here. We're getting a lot done. We're hopeful to get some significant stuff done this week and in the remainder of this month and in September. And I think seniors across Arizona are going to be pretty satisfied with the results here if we're successful. So thank you for having me on. And we're going to continue to work hard. If you got any issues that you need addressed, or anybody on this call, I've got a team of people in Arizona and here in Washington, D.C. that are here to help. Issues with Medicare, Social Security, those things, we are here to help, and we can help, especially if you have a problem dealing with a government agency. So feel free to contact our office.
Yeah, I know how important those caseworkers are, and they actually solve a lot of problems, especially, if people are a veteran and are having any problems with VA benefits. I know that those caseworkers know how to crack that nut, which is sometimes a little difficult. So on behalf of AARP Arizona, I want to thank you and everyone for taking part in today's live Zoom video call with United States Senator Mark Kelly. Senator, thank you for joining us today. Thank you to our members and volunteers, and for participating in the discussion on these important topics. We apologize if we were not able to answer your question. You can also obtain valuable information through AARP publications on our website at aarp.org/AZ, or by calling 1-888-687-2277. Thank you for joining us, and have a great rest of the week. And this concludes this presentation. Thank you, Senator Kelly.
Thank you.